person for the mandatory blood lead testing of the lead poisoning prevention program of the Iowa Department of Public Health. With me is John Satry, who will walk you through the steps to submit your data for this year. He is the informatician of the Public Health Informatics at the Information Management of this department. I would like to acknowledge the strong collaboration of my colleagues Annalisa Peterson, Melissa Walker, and Stuart Schmidt, who were part of the committee, the planning committee for this webinar. I would also like to thank Swani Rasmussen. Sorry for my bad pronunciation here. She will be working very closely with John in the automated process of the matching data. Also, Andrea, Janet Lemmerman, and Kathy Linningkugel. And of course, my close friend, Kevin Officer, who has been with me all of this time, helping me out with the setting up of this webinar. And he will be actually tracking all the questions that you may have during the time of this presentation. A couple of housekeeping items. If you would like to apply for the nursing 0.12 CUs that will be offered with this webinar, you need to remain the first hour. Also, I will be sending you the certificates, regardless if you claim nursing CUs, I will be sending you the certificates next week. This webinar will be recorded and posted early next week. However, no CUs will be provided. You don't need to wait at the end of this presentation to ask questions. Please use the chat tool that might be on the top of your screen and to start sending your questions right away. We will do our best to answer them. We will create also a document with this information and we will make it available in the website at the end of next week. The documents for the submission of your school data are posted in the website address that you are seeing in number 5. That's the address where you should find all the materials for this presentation and also for the Excel sheet and instructions to submit your data. Be aware, however, that this afternoon you will receive the same information to submit your data via secure emails. So the details will be provided at John's intervention. And I realized that when I print out this handout that the slide number 21, which is the matching process, did not print completely. So we will be sure to make this available in the website by checking what is wrong, and so you can print it and have it available as well. This is what the agenda looks like. Please take a few seconds to read through. Our goal is that at the end of this webinar, you have more knowledge on the impact of lead poisoning in Iowa and in our children. Know that the main content of chapter 67, which hosts the mandatory blood lead testing. Know the results of last year's enrollment and receive all the necessary tools that will facilitate your work in the submission of this year's kindergartner's enrollment. Let's start with what is lead. Lead is a metal, but unfortunately it's also a poison, and it becomes a poison when it starts deteriorating, and is very resistant to corrosion, but oxidize upon exposure to air. So the picture that you are seeing here is a very characteristic picture of a lead-based paint surface. This is a lead hazard, and this is how our kids are getting lead poisoned. because they are eating either the chips, the paint chips, or the dust that this deterioration creates. In Iowa and many homes in the Midwest, the number source of lead poisoning is or are the pre-1978 homes, because these were painted with lead-based paint. So the older the house, the greater chances for lead poisoning. Here we can see that how Iowa compares to the national average in age of pre-1940, pre-1950, and pre-1960 housing. It also shows how we are doing comparing to the national level. According to the American Community Survey, which stands for ACS, there has been a slight change in the rank of pre-1940 homes, because in 2000, we used to rank in third versus fourth in 2012, between 2008 2012. So, but we still see that our percentages here are higher than the national average, which means that we do have a big problem here of lead poisoning in Iowa. This map also shows the presence of pre-1950 homes in the state. You can see here that Iowa has almost 34% of homes built before 1950, when at national level we only have 19% of those old homes. And the colors you see here, for instance, starting with the yellow, orange, and red colors, those are the counties that have a bigger percentage of homes very old, pre-1950 homes, which means that the chances for kids to be lead poisoned are higher in these counties. This graphic shows how children and adults can be lead poisoned and how fast this can also be a problem or impact the organs in our body. So you can see here that in 25 days, a child can be drastically or severe damage because it goes to the blood. The lead goes to the blood, and see, in 45 days, it goes to the brain. The lead poisoning goes to the brain. So we have here more organs and tissues, soft tissues that also are damaged. And for a person who continues working with lead, which is the case of adults, we see that lead can last for up to 30 years in bones and teeth. So this is something to be concerned about, because the longer exposure, the more organs and learning problems we will have in our kids. It's very hard to find symptoms or to identify these symptoms in our children when they are lead poisoned, because it's very easy confused with other common illnesses like a cold or a flu. So some of the early signs and symptoms of lead poisoning in children are confused with other common childhood health conditions. But pretty much what we are seeing here, like fatigue, stomach ache, irritability, and other conditions, are very common signs of lead poisoning. I like this graphic because it shows here how lead poisoning impacts the IQ of our children, of an adult as well. So the score in the United States is 100%, is line here. And we see here in this column that individuals with an IQ score between 50 and 70 are classified as moderately retarded. However, in the right column, we see that individuals with IQs scores between 125 and 144 are the ones who are classified as gifted or highly gifted. So a recent study done by Hilary Wooding that did a study on the lead exposure and poisoning in children with the Institute of the Environment and Sustainability, and this was done in last year. She emphasized what other studies also have also proved. She found out that the increase of blood levels of 10 micrograms, which is the green line, is associated with a disease score of 4.5, 4.6 points, almost 5 points. So we see here that the line, the blue line, which is a 5, that will be 5 levels will be impacting, but it will be more impacted if the child has blood levels in the range of 10 micrograms per deciliter. So we probably don't see much difference in these lines here, but when we see these lines coming down to this classification, then is when we are seeing more of our kids who have high blood levels falling down into this category of retardation, which will mean in other cases learning disabilities for many of our children. CDC lowered the level of concern from 10 micrograms per deciliter to 5 micrograms per deciliter. And it was reduced because CDC, through the studies, come out to the conclusion that 5 micrograms per deciliter can still affect and have some severe consequences in our children. So this is the new blood level that we are using to determine the exposure of a child to lead. Now, what does Chapter 67 have to do with all of this? Well, Chapter 67 is actually about the blood lead testing, and the main goal here is to improve the health of Iowa children. So this bill passed at the end of 2007-2008 and required that all children entering kindergarten should have an evidence of at least one blood lead test. Children will not get out of a school. And the also importance about Chapter 67 is that with this, by capturing these children, we will be actually also taking care of the problems or potential problems of learning disabilities that they should probably show when entering kindergarten. So the Chapter 67, through the blood lead testing, we also believe that we'll be facilitating the early detection and referral for treatment of lead poisoned children. As I said before, there must be an evidence of a blood lead test, and this evidence of this blood lead test has to come from a lab result from any of these places that are listed in this slide. And to be valid, it has to be performed on an applicant or transfer student before the applicant or transfer student reaches 6 years of age, or in cases in which the applicant or transfer student has already reached 6 years of age. As soon as the department notifies the parent or guardian that a blood lead test has not yet been performed. We strongly encourage the parents have their children tested at the age of 2 years. That's what we encourage. If there has been a misunderstanding that we are encouraging parents to test their kids until they are 6 years old, we are encouraging parents to have their children tested as young as possible. And here are the two types of blood testing that can be done in a child, and these are the tests that can be valid for the evidence of a one blood test. It can be capillary if it's a finger stick, or venous if it's a vein draw. So if the initial testing is done with a capillary sample, then levels greater than or equal to 10 micrograms per deciliter must be confirmed with a venous sample. So, and then it will need to be followed up later. Now, if the initial test is done with venous or vein draw, then it will need to be followed up based on those results. This is the basic lab testing chart that we have available, and that physicians and nurses do have available with them, because it gives the information about when test. So we see here the low risk testing chart and the high risk testing chart. So actually, you see here on the left side, especially that these children need to be screened at ages of 12 and 24 months, and if the child is older than 2 years, then they should be screened once. So, and again, if these levels are below 10 micrograms per deciliter, they do not need to be tested again. However, on the other side, you see the high-risk testing, and this shows the children that are at high risk for lead poisoning. These children need to be screening every 6 months and starting at the age of 12. They do have a questionnaire that has several questions, and parents need to fill out this questionnaire for the physicians to follow up on what testing is necessary to have for these children. I want to warn you that this risk classification is not the same, especially when we're talking about the low risk classification. This is not the same as the low risk exemption. I will explain more in detail what the low risk exemption is. But exemption is actually waiving the opportunity to have a blood test, and the low risk is actually doing the test to a child for the criteria. This graphic shows the children that who have been tested since all of these years, since 2000 to 2014. So see that how the column here went so high in 2008, and that's is because of the law that was passed, the bill. And this shows how many children have been tested during all of these years, and we saw and see a slight number reduction in our children in 2014. The number of children confirmed equal or greater than 10. We see here that in these bars, these are the children who have been tested. However, the children who were confirmed of having a blood test of equal or greater than 10 has been reducing, and we acknowledge that we need to work more on capturing those children whose levels need to be confirmed at the level of equal or greater than 10. We have been talking about blood testing and haven't talked much about who is going to pay for this test. Well, we understand that private insurances are taking care of this, as well as Medicaid and Hawkeye, and some health departments are also helping us with that, and some clips if the child is under 6 years of age. here are the exemptions to have a blotlet test. I'm going to stop here a little bit because we have been receiving information that the sound is not that clear. So let me change the set. So let's go back to the slide that I had. Okay, so we were hearing the exemptions to have a blotlet test. Parents have this have the option to request a low-risk exemption and a religious exemption. The low-risk exemption is granted by the Department of Public Health, and Stuart Schmitz is the only person in the department who can do that. So if parents need to have a low-risk exemption, they should contact him to this information that appears in the screen. I will show you right now how at the end, how a low-risk exemption certificate looks like and how a religious exemption also looks like. The religious exemption is, both of these are placed in our website, and the religious exemption is actually an acknowledgement of the parent who refuses to have a blotlet test for the child, and because of his or her Christian beliefs. They can download this directly from the website, or call me or contact me if they need that via email or mail. Both of these exemptions need to be notarized, and this is the document that they have to bring to the school nurse as a proof that in fact they are not going to have the child tested because of these exemptions. We are not promoting this, I want to clarify this, but we need to have them. Is in the code, so we cannot get rid of them. Now let me show you how these documents look like. This. Oh, okay. Low risk. So this low risk is exactly, this document is how you are going to see the information when a parent brings it to you. It has to be notarized, signed, and dated, and this is what the parent is going to show you. And the religious exemption certificate looks like this. This is also the document that a parent should show you. Okay. Okay, so let's switch to the presentation right now here. I'm going to leave this information just to stay with the presentation here. I need to go back to, yes. Okay, thank you. Sorry for the technical problems we're having. Okay. here. There are many people involved in this process. Schools are one of the main partners of the Department of Public Health, because without them, we could not be able to receive all of this data. And we appreciate pretty much all your help and your effort. We have the labs collaboration, the physicians, schools, nurses of the several departments of public health, local agencies. We all are a team, and we are learning in this process. I know. I'm going to show you the school matching process for this year, and John is going to go into more detail about this, but we will originate information via secure email with the new spreadsheet. This spreadsheet is going to be shorter than other years, and this will probably be better for all of us. The school will respond to the list of children enrolled in kindergarten or younger if they need to report those children. And once we receive them via secure email, we will match the data with our system, which helps state for Healthy Homes Lead Poisoning Surveillance Program. The results of non-tested children are going to be provided to the school nurses. Then school nurses will contact parents for those children who need to have their children tested. And the main goal is that parents have their children tested. This year, you don't need to send me any blood lead test. Parents don't need to send me blood lead test. This is changing. We don't need to have that information. Schools have been very proactive by requesting the blood lead test from parents, and you are free to continue having them, receive them, but I don't need to have them in my end here. Now, in terms of the results of 2016, 2015, 2016, we had a school enrollment of more than 39,000 children, and 70% of them were able to send us their list of children. So we appreciate that, but they still were short of 30% of our children across the state. Out of 333 districts, we captured 250 districts. In other words, we received the information from these 250. So 75% of them reported, but we are still short of 25%. The non-match kids are more than 8,500 children that did not match according to our database, which was 40% of the school file. Yes, there were problems. This data was not 100% accurate. We have several issues, and this means that we need to work harder with our database. We even have problems with the version of the Excel sheet that some schools submitted to us, but those problems will be solved with the automated process that John is going to explain you in more detail. So most of these problems that we're seeing here will probably be solved with the automating process. I took a sample of the blood tests that I received, which were almost 800 blood tests, and I sampled 52% of them, and in fact was able to prove what you said, that most of those children whom we said have no blood lead test did have a blood lead test, and this was a 56% of children found. This is the there is an echo. This is the type of communication that counties or some schools used when they reported the blood test of those children who apparently did not have a test, but they did have. And so the ones that in green color are the ones, the counties that did not send any report, and this probably also means that are the ones that that we didn't capture last year. So those school districts might be the 25% of those might be represented in this green color. And we see that electronic submission, like the pink and blue colors, which is pretty much what is across the state, prefer those means of communication. So we believe that there is not going to be a problem with a secure email, because that's a way to communicate for many of them. In here, we are seeing that the counties in dark color are the ones that actually provided more information on bloodlet tests that kids had. Now, we have some changes for the 2016-2017 school enrollment, and I want to leave John Satri with you so he can explain you in more detail what all of this means.
Okay, this is John Satri, and I'm going to go over the actual process that you'll have to go through to receive the template that we're talking about, or that we will be talking about, and return it to the Iowa Department of Public Health. So this image is the big picture of the entire reporting process by which we are going to identify whether or not new kindergarten students have had a blood test prior to entering school. New features of this process include secure messaging from schools to the Iowa Department of Public Health and vice versa, automated communication, file processing, and reporting back to schools, quicker reports of students that have not been tested back to schools, and we plan to do this by November 30th of 2016. The process is going to begin, let me see if I got a cursor here. The process is going to begin with a secure message sent from the Iowa Department of Public Health. The email account that it will be sent from is listed here in this box, school.led@idph.iowa.gov. The secure message includes instructions in the body of the email and an attached Excel template for collecting information on both students and school contacts. The way this is going to work, though, is that the secure message is initiated here. The actual message goes into a black box, so to speak, or a locked box that's secure. And an alternate email is going to be sent to the school contact that we have. If you've received an email from our listserv, then you're one of those school contacts. So at that point, you will have to create an account by responding to that alternate email. There will be a link in that. You will log into this portal, the same thing as this secure box, to retrieve the email. And again, let me reiterate, the secure message includes the instructions in the body of the email of how to respond to this. There are some very detailed instructions. It will also include an attached Excel template for collecting information on both students and the school contacts. The actual secure message stays inside of a secure box while an alternate message is sent to each recipient. The alternate email contains a link to the iowa.gov secure mail portal. The recipient will need to create an account for the portal, then log into that account and retrieve the template, which must be used to return the list of students on one tab and the list of school contacts on another tab. Once the list of new kindergarten students has been entered and the list of school contacts has been entered, the school contact will need to log into the iowa.gov secure mail portal again, attach the completed Excel template to a reply, and send it back to the school.led@idph.iowa.gov email address. I want to emphasize that the template needs to be returned using the reply feature within the email. And we're going to look at this in great detail in a few minutes. Once all of the student lists have been received by October 31st, 2016, the templates are going to be matched, and now I'm referring to the box down here. The templates are going to be matched against blood lead tests that have been reported to the Iowa Department of Public Health since 2009. Those children for which we are unable to find a reported blood lead test will be placed on a report and returned to each school contact. There is a challenge in this process, but we have a solution. The link in each secure mail message expires 14 days after it is sent. So to ensure that you have an active link through which you can reply, a fresh secure mail message identical to the original will be sent every 10 days. You should always have a reply through which you should always reply through the most recently received secure mail message. Okay, we're going to go through the steps of this. And at the end of this presentation, I'm also going to go through a demo very slowly and deliberately so you can see this. The most challenging part of this is creating the account. At this time, strange email poses a significant security risk to computers and networks. Clicking on links within email messages is something that IT security personnel discourage us from doing. So we want to show you now what this message looks like. And it won't be exactly like this, but it will look very similar to this. This is an image of what the alternate email message will look like. And again, the email will be coming from school.lead@idph.iowa.gov. We will be sending the first secure email today, so expect to receive a message that looks like this by the end of the business day this afternoon. You'll have to create an account in order to retrieve the template. We would like you to do this within the next week or so that you'll have had a chance to handle the template prior to an upcoming question and answer session scheduled for Tuesday, September 27th at 3 p.m. The first step is to click on the link that's found within the secure mailbox or the secure email. The second step is to click on the link. Carefully follow the steps to create an account. The most challenging part, as I mentioned before, is creating the account, but it's not difficult if you carefully follow the instructions. If you carelessly go through the steps, it is likely that you will be unsuccessful in creating the account and you'll have to contact someone at the Iowa Help Desk. This is something that you want to avoid. I'll be able to answer questions about any other aspect of this process, but resolving problems with a secure mail account is out of my hands and handled by a different state of Iowa department. So in the email, and we're going to look at the email, you'll see an account details section. The account ID is very important. You'll also see an account activation link. This takes you to a portal. The activation link in that email can only be used once, so be very careful once you start this process. The fourth step is to log into the iowa.gov secure email. So this is creating the account, and this is logging into the secure mail portal after you've created that account. You'll retrieve the template, complete the template, enter the complete kindergarten student list, enter the school contacts, and we want you to enter one contact per school is all you need to enter. You won't need to copy a bunch of the same items down in rows or anything. It'll just be entering it one time. You will return the completed template via iowa.gov secure mail. The 8th step is to retrieve is something we're going to do, and that's we're going to send you a report through secure mail again. So you'll get another message, and that message will direct you to retrieve the non-matched student report when notified by the iowa.gov secure mail. And the 9th step, or the last step, is really to inform the family of the required lead test for non-matched students. Okay, so there are a few critical steps when saving the template. So we are attempting to automate almost every aspect of this process this year. To be successful, there are 3 critical points that I need to make to ensure that the information flows smoothly through all these automated steps. These steps are easy to follow and most likely things that most of you would not even consider doing. First, do not change the structure or layout of the template. Do not hide, add, delete, or rearrange any columns in the tabs of the Excel workbook. Do not hide, add, delete, or rearrange any of the tabs in the Excel workbook. Second, do not add any protection or passwords to any of the tabs of the spreadsheet or the entire Excel workbook. The information will be protected as long as the file is transmitted through the iowa.gov secure mail portal. The automated processing depends on the consistency of the templates that is sent to you through the secure mail message. For this reason, it is important that the file you return is in the same format as it was sent, which is an older version of the Microsoft Excel format. If you use something other than Excel to open the file, please use the Save As function to make sure it is saved in the Excel 1997 to 2003, or sometimes you'll see it as .xls format. If this is just impossible for you to do, because you use some software for which you are unable to save it as an Excel file in this older format, return the file through the secure mail process anyway. So everything will remain the same, you just won't be sending an Excel file. Lastly, the automated process assumes that only one template will be attached to an email. If for some reason you need to return more than one template for any reason, please send each in a separate reply to the most recently received secure email. So, for example, if one person receives a template in a secure email message and distributes the same template to 3 other people to complete the student and school contact lists for different schools, so there are a total of 4 different files, 4 separate emails should be returned in 4 separate replies. This slide displays the tabs that need to be completed in the template that is returned to the Iowa Department of Public Health. The top image is of the Students and School Info tab where the student information needs to be entered. It is important that all of this information be carefully entered and is accurate. It is important that you use the student's official last name and official first name. These names will be matched against names coming from medical information systems, which are typically official names. Automated matching will be based on the last name, first name, and date of birth. A secondary manual matching process will attempt to identify non-perfect matches where there may be slight variations in names and reduce the number of non-matched students that are returned to schools. For multi-part names, please enter these as they appear in your records. If a name like Van Gogh is separated by space in your records, use a space. If the 2 parts are separated by a hyphen, use a hyphen. Do not use suffixes such as junior, the second, or third. Be sure to mark it if a student has either a religious exemption or a low-risk exemption on the student tab over here in the far right. The name of the school appears on both tabs and must match on both tabs for the same school. The number of the school district appears on both tabs and must match on both tabs. If you do not know the number of your school district, a hyperlink to a resource to find your school district number appears in the instructions that is going to be sent to you through the GovDelivery listserv, as well as it will also appear in the instructions found in the body of the actual secure message that you will see when you log in to retrieve the template. On the school contact person info tab, you need only enter each different school name and school contact with the other information associated with it one time. This information will be linked to the student information by the school name and the district number, which is why these must match on both tabs. Okay, and we are going to go through a demo real quick. And I'm going to switch to Outlook. Okay. Okay, we've already sent the email to this mailbox, And you'll see that this is what it looks like here. Very similar to what we showed you before. This is the link. So this is a secure message has already been sent to this address. And this is the alternate email that I mentioned. We have to log into the portal to actually retrieve the real message. So you'll see this click here to start the account to start the create account process. So click on that hyperlink. This information is going to be used to create your ID, your user ID for the secure mail account. Typically using your first name and last name will work. I'm going to make sure that we don't have anything that matches anything else with this account. Okay, so I'm saying my first name is IDPH and my last name is School Nurse. Then I click the register button. You'll notice that IDPH School Nurse, my first and last name, was transferred to the account ID field, and my first and last name were transferred here as well. Now I have to enter my email address. And this is the same email address to which the original email was sent. And I have to confirm it. And then I click Save Account Details. Double check my email addresses. Okay, you're about to register for a new account using the account ID located at the top of the form. It's idph.schoolnurse. All spaces and most special characters will be stripped from your account ID. So that's true if you add numbers to your name. It's going to strip those most likely before it transfers to the account ID. So it's very important to pay attention to that account ID. And you're going to actually receive another email. So this is notice of the confirmation email. So another email was sent to the mailbox. You can see I've got it right here. Okay. Now it's important to, I want to point out there's an account details section right here that provides your account ID, your name, and the email address that is associated with this secure email account. I'm going to actually copy that account ID because I'm going to use it in a little bit. There are also some very specific instructions. This is the activation link, the step 1. You'll want to read through these instructions very carefully. Step 1 is to click on this link right here. You're going to be asked to create some security questions. 2 of them will be from drop-down lists, and the third one is one that you make up on your own. And there are some rules. You'll also be asked to create a password, and there are some rules for creating a password that are in step 3 here. So you'll want to have this email open and handy, or printed if you can, at the time when you create this account. I also want to point out that this link here is valid only once. So once you click this, you need to be very careful and follow through with the instructions. Okay, so what was the name of your childhood pet is the first question I'm going to use. I have to enter my answer twice. I'm going to use the second one. What color is your truck or car? I have to enter that twice. And my third question, I'm just going to create a silly, my favorite color. Okay, now I'm asked to create a password, and it has to follow those rules that we talked about before. It actually does provide the rules right here. So I'm going to create that. It's a mix of upper and lowercase letters, special characters, and numbers. Okay. Now that is not the account that I want to use. I copied it earlier and I'm going to paste it in there now. And I need to use my password here. Pressing sign in. Okay, now it's going to take me to a log on screen. This is the last step of the process before I log in. Here's my login. I use the same password that I just created. And I don't know why it stopped. Try that again. There we go. There's a disclaimer. Once you've logged in, you accept the disclaimer. And then it opens the mailbox. And it'll load the message that was originally sent to you. Okay. So there's a couple things that I want to point out here. First of all, this is the body of the message that you'll receive. It's got some very detailed instructions here about the template, how to complete the template. It talks about many of the things that I already addressed, about what to enter. Do not use the child's suffix if there's a suffix involved with the last name. It also refers to the upcoming question and answer session on Tuesday, September 27th, 2016 at 3, and provides some contact information. So those are the instructions for completing the template and returning it. There's an attachment that will show up down here at the bottom, and that is the actual template. And the print is up here. And when you do actually complete the process, you'll want to come back into an email very similar to this. Again, we're going to be sending this over and over again every 10 days until the deadline, and everyone will receive this secure mail message. We don't have a process for determining whether or not you've returned the template or not. We will be sending it to everyone that we have in our listserv as a contact for a school. And so once you've returned the template, you can ignore all future messages that come to you until October 31st. So I want to open the template, which is down here. You will want to save it probably to your desktop. I'm going to save it to my desktop. It already exists on there, but I'm going to replace it. And then I'm going to go to my desktop and find it. It should be this one right here. Okay, and then we've got, this is the actual first page where you would enter students. This is the second page where you enter the contact information for the school. And we've got two tabs that are examples with some information filled out. Oh, okay, yep. This is so we'll fix that before we send the template out. This example shouldn't have junior in it. One thing you'll have to do before you start editing or entering information is enable the editing click that button, most likely. And we will fix this. This shouldn't be in here like that. And this shouldn't be here either. So no suffixes. You'll notice Van Gogh is actually entered with a space. So that's what we'd expect you to, I mean, how you would return it. If your records indicate that it has a dash, use a dash. And then we've got an example sheet of the contact person as well. So now when you do go to save it, I'm going to save it here. And I'm going to close it. And I'm going to return to, let's see, it was, here we go. I'm going to reply to this message. This is what you'll do, and you should always have one of these whenever you're ready to return one. And again, always use the most recently received secure mail message that you have. So I hit reply, and I'm going to attach a spreadsheet, or that actual template as if I'd completed it. I go to the desktop where I stored it. There it is right there. Okay, you can see that it is now listed in the box. I'm going to click the upload button, and it will show me some progress. Once that box disappears, it is uploaded, and you can see it here, attachments number 1, and it's listed right here in the field. And you can hit send, and that completes the process. Great. So I'm going to turn this back over to Rasani. Go back to the presentation.
Thank you, John. We are about to complete the presentation here with the slides, and this is the timeline for this new school year data. Every year in fall, we are going to be contacting you to submit via secure email this information. We do apologize for being late with this information or email that we will be sending you. We just wanted to be sure that this time is going to work much better than other years. So we preferred waiting a little longer, but being sure that it's going to work more accurately. So October 31st is the deadline for school submissions, as we have emphasized via secure email. We will be able to receive requests for low-risk exemption until December 31st. And if school nurses do not have those certificates and still send their list, that is perfectly okay, because we don't expect parents to have this information soon. So when we get back to you with the non-matched kids, and you happen to have some of those certificates of low-risk exemption or religious exemption, then you will not need to bother those parents, because they will have already submit those notarized certificates. And we do expect to get back to you by November 30th with a list of non-tested children. This is our information. Please feel free to contact us, and this is get familiar with our website, www.idph.iowa.gov, LPP, and all the information. Everything that we have given today is already there in our website. You have our contact information. You are not alone in this process, and again, we do thank you for every single thing that you have done for us to have some data recorded and especially knowing that we are getting back to parents to do their job. It's their responsibility to have their children blood tested. They are the ultimately actors here who need to take action on the blood testing for all children across the state. I do apologize for the technical issues that we had at the beginning. I hope that at least the part that John Satri took care of was clear enough for you. And now is the time for you to, and actually for us to answer all of those questions that you have been submitting through the chatting. So I'm going to have John Satri get back to here because there are several questions in regards to the secure email.
Okay, the first question is, if I already have a secure email account with my local IDPH, can I use that account to send you that information? If that is the same email account that we will be sending to, you can use that account. You cannot initiate a secure email message from your side though. So if the email account is, again, the same as what we have for you, then that will work. Second question is, has the secure email with the link already been sent out? No, it has not. It will be sent out later this afternoon. Third one, this says this can be copied from an Excel and pasted onto your form template. Correct. That is correct. Yes, as long as it's in the same format as the template that we send. Is there ability to transfer files into the spreadsheet, or does it need to be filled out student by student? Again, it can be copied and pasted. That's not a problem at all. We have very little formatting on any of those fields. Nothing is locked. So, so we first submit the names of all kindergarten students. Yes, all kindergarten students should be submitted from your schools. Another question, if our district covers more than one county, kindergarten rooms in separate counties, but in the same school district, separate submissions, district is actually 4 counties.
We decided that all the children under that school nurse responsibility will be listed in the same Excel sheet.
Okay, so if the school is in an official county, you want to use that county? Like if the school address is in, is that correct?
That's correct.
So wherever the school, the actual school where the student attends exists, whichever county that is in, that county should be associated with that student on the template, correct?
Well, I'm a little confused here because it's yeah, we will be. What I'm more concerned is about the school. The school's nurses are responsible for X number of children. And if these children fall under different counties, that is perfectly okay.
Okay. So it's
So they still need to submit that in that sheet where they need to.
Yes. So let me reiterate that question. If our district covers more than one county, kindergarten rooms in separate counties, but in the same school district, separate submissions, they do not need to be in separate submissions. They can all be in the same template, the same Excel spreadsheet, as long as the information for each student is accurate. That's fine on that row. We will handle all the separation by counties. One thing I didn't mention is the report that we're going to send is by school. So if you have 4 different schools that you are responsible for, you will receive 4 separate reports, all through secure mail, by email. It'll be school. You'll receive 1 file for each school name that's on the spreadsheet. No, each district. If a district has 4 schools,
to the email, so we don't know if that email is tied to 4 schools, then it will still be 1 single.
1 single email for 4 schools. Okay, I was just corrected on that. So we're going to send 1 single email for every every file that comes in associated with the same sending email. So the person that returns the template, that email will be associated with the file that they return, or multiple files, but they will still receive only one file back. No, they'll receive multiple files depending on how many spreadsheets were sent in. Okay, so we'll be sending templates based on the sender. Okay.
And we'll clarify that through written Q&A. So
Okay.
we'll have a Q&A that we'll post to the website later to clarify all that.
Okay. Next question: Would you have record of students being tested for lead in another state? No, we would not. Next question: We have several students that utilize clinics out of state, Minnesota, for example. Do you get records from out of state clinics on lead reporting? We don't.
No, just because of confidentiality and other issues like that. We don't.
We have a family of 4 prior Amish children who have been enrolled in public school. Once a child is a kindergartner, I have requested the parent to take the child for testing. Does public health clinics do this, or only the physician clinic? Either the physician or public health clinics can perform the test, right? Yeah, okay. So either of those, several public health clinics as well as physician clinics can draw the blood and have it tested. Next question: Is there a generic letter to send to parents whose children still need lead testing, or
Yes, we will,
you cannot find a record of it being completed?
we will have it available when we send out the results.
Yes, when we send out the results, by the time,
So send it.
by November 30th, we will have a letter, a standard letter that you can use to send to parents. Next question: 2 counties have kindergarten classrooms, same school district. Same, yeah, we've answered that question. They can be in the same spreadsheet. Should this include AK?
Pre-K.
AK?
Pre-K.
Pre-K? Okay.
If the school needs it, yes. We will separate the ages here.
Okay, the full question was, should this include pre-K or not, since they would be on the kindergarten list for the following year? You can include these and we will provide feedback on those students. Next question: Can you import this data for the Excel from JMC? I do not know what JMC is. I'm getting head shakes that indicate no, very unlikely. Next question: We submit the names to your department, then do you return us the ones that need the testing? Yes, we do. The report that you receive back will only be the ones that we cannot find tests for. What about JK kindergartners? Do we include them? Is that pre-K also? Okay. Okay, so yes, you can include them. Next question: Could you send to one person in the Iowa City Community School District? One person will be sending the files for all buildings. We are going to be sending to an entire list of contacts that we have. You as a school district can determine how you handle reporting back. That is up to you. Next question: If we have a student's blood level, but you don't have that result in your database, how do we get that to you, and what info do you need? Result provider, etc.
I think there is I'm going to take some time later because they don't need to be asking at this moment for blood test.
Okay. Rasani wants to address that in a few minutes, or
Yeah.
Okay. Okay. Next question. Alternate. Okay. If your district has one central secretary submitting separate kindergarten rosters for each building, does this person have a secure account? Does each school nurse also maintain a secure account? This is certainly up to you. You will not likely be able to create the secure account unless you receive the secure email from us. So if the central secretary is not on the list as a contact for us, they won't receive an email from us. Yeah, so we can actually, if you contact Rasani, we can send a secure mail which will offer the, and then, yeah, so if you want to update the contacts for your school district, please send those to Rasani, and we will update our list and incorporate any new contacts in the secure mail that's sent every 10 days. So we can add new people to that list through this process until October 31st. Well, whatever the day is, the last time we send the template. Will the letter we send out to parents about not having a record of lead testing tell them what to do? Okay, do we need to get the lead results from parents and send results to you? Rasani is going to address that in a few minutes here. Is that the last question? Okay. After we contact parents of children without lead tests, what do they do? Okay, that's the same kind of issue Rasani is going to address. Does the Excel sheet have to be filled in student by student, or is there ability you can copy and paste into that file? Let's see. We only send children that are kindergarten. Okay, I think we've already answered that question.
That's more of a comment. I think the rest of them might be more for Rasani to address. That's just a comment on what they perceive as difficulties.
Okay. Okay. Okay, I'm going to turn this over to Rasani.
Thank you, John. I heard some of the comments here that some of the school nurses, or I don't know if I misunderstood, were requesting blood tests for children to have. I want to clarify that we are only requesting you to send us the enrolled kindergartners. We don't need to have you involved with the blood testing in terms of asking parents to have their children tested, because how this law works is that you send us the enrolled kindergartners or pre-Ks. If you need to report on younger kids, we will still accept them. And then when we get back to you, we tell you who are the kids who will need to have a blood test, and then you will contact the parents with the letter that we are going to send you, and by stating that that particular child needs to have a blood test. Your responsibility will be to send that letter to the parent, and that's going to be pretty much your work. It's going to be up to the parent to have that child tested. Hopefully they will have it tested. That's our goal. And but we cannot put you in the situation to follow up with blood tests, because we have realized that you have too much work to do. So I don't think it's right to ask you to follow up on those blood tests and get them to you. I know there are schools who are requesting blood tests as a way to really know who are those kids who might need to have a blood test after we get back to them with the list. They have been very proactive by having those blood tests. So when I get back to them and say, hey, these are the children who need a blood test, they say to me, you know what, I do have their blood test, and it's not true. I have this and such a child that according to you doesn't need to have a blood test. I do have the blood test. But those are special situations, and I don't want to generalize, because it's up to each school how they want to manage the whole process. We are ending the process by you recommending sending the letter out to the parents and have the parent to make the decision. That's all what I can say at this moment. Now, in terms of other questions here that we're supposed to, yes, we are going to send you that letter with the specifications. It's going to be a very simple letter. Nothing to worry about it. And what were the other questions I was supposed to handle here? Seriously, do you think our time grows on trees? It was much easier to email the Excel spreadsheet we have done in the past. I don't have the time to mess around with all your specifics. I also have nurses in 9 different schools. I assume I'm going to have to submit for all of these nurses since I'm the contact person, which I do not have time to do. In the past, they were able to submit much easier the old way. Don't be surprised if your response compliance drastically drops with this new method. You are right to say how you feel about this process. It may be tedious at the beginning because it's new. I understand it is completely new. And but after all, what we are earning with this is to protect information, because we were actually pointed out that we were not managing the information securely, and that was an issue that we as the department took very seriously from you all, and that's why we created this method of communication. I do believe John Satry and Swati, who are the experts in this school matching, if they need to sit down with you on the phone, walk you through that secure email, that is going to be possible. You are not alone in this, and as I said before, it's our responsibility that you understand how to do this. So if you feel like this is too much to do, we are going to work with you. If we need to spend more time in walking you single in one basis, I mean, just one-on-one, we will do it. We have to do it. And yes, we will follow up on those school districts, because everything is going to be automated. It's going to be easier for us to identify who those school districts are that haven't reported to us, and we will be in touch with you just to make sure that we are going to get those enrolled kids for this year. Could you please reinforce that any question should be sent to IDPH to not contact local public health to request less results? Yes, in the letter we will state that the results that they are getting are the results that will be probably in the desktops of many local health departments, because it's the same data that we will be handling. So we will be sure to put that information there, so you will not be bothered with phone calls from parents asking you to follow up on blood tests. If the parents' responsibility to have those blood tests with them, they should first contact their primary physicians. They are the ones who should be responsible for all of this process. All of these questions that you ask us will be put in one whole document with our answers, and we will be sure to have this document posted next week. So for next week, we will have these questions and answers posted in our website pretty much at the end of next week. That's what I'm visualizing. We will also have the link to, actually, we are going to send you out an email with the invitation to register for the upcoming webinar to answer all your questions, because you probably will have a lot of questions in regards to the secure email. If you succeed or did not succeed, or if you have some issues or have more questions to ask, that's going to be a way to release all your concerns and frustrations or worries. So it's going to be, the next webinar is going to be on September 27th. That's going to be a Tuesday at 3 p.m. It's going to be an hour webinar, and we will be happy to answer any questions that you may have, or comments or suggestions, whatever you need to handle. That will be a very good opportunity for you. So we are going to send you that information via email. for those who are still not in my listserv, I will also post in our website. Again, that's the website that you can see here, which is www.idps.iowa.gov. If you go there, and actually, if we could go to the website right now, that will be even better. So you can be familiar with our website. And that's what we are doing right now, to show you exactly where to go to find all the information related to the Excel sheet, the instructions, and the information related with the mandatory blood testing. So, okay, so here is the website. This is the face of the Iowa Department of Public Health. Well, this is mainly the program for lead poisoning. So this is how home looks like. This is the face of the, if you just type www.idps.iowa.gov and then click here, LPP, that should take you straight to our website, the lead poisoning prevention. And so you go to look for programs in your column, left column here. And in columns, you will find the mandatory blood lead testing. And here is where you are going to see a little explanation about what this program is about. And you can see here already the introduction for completing the kindergartner's enrollment spreadsheet, the instructions, I mean, sorry. These are the instructions. And this is the other file that you will see here is actually the spreadsheet. So, and here are the exemptions, the religious and low risk exemption. Again, if somebody clicks here, they will not find the certificate, because again, this is something that they need to call to get that certificate. S2 is going to ask several questions to the parents. If they meet the criteria, they will be given a certificate. If they don't, they cannot be granted with this low risk exemption. So just for you to know, and parents to know. So thank you. And I'm here just for see the information that we have for this webinar. This presentation materials, this PowerPoint presentation is in here. So if you click here, you will find this PowerPoint presentation. Well, it's coming up. Oh, it's the one that we just downloaded. Okay, I just want to show you very quickly, because we're running, getting just closer to the time. This is the instructions. The same information that you are seeing here is the one that you will receive today with the secure email. This, you might want to have this because the secure email text codification is different. So this is more friendly for you to read. And this gives you all the details about how to save your spreadsheet. And also what to do with each tab, how to fill out each tab. This time we changed, instead of numbering, we yeah, it's not the most recent, right? I just realized that because of we will immediately change these instructions, because I believed we have given the right one, but it's not this one. So we will definitely put that immediately after we are done with this webinar. I don't know if we have more questions to cover.
One more point. I believe there's a link on the Department of Education's website to the under student health requirements to our web page. So on the Department of Education's website, there is a link to this, to the lead poisoning prevention program's webpage under student health requirements.
That is great, Melissa. Melissa Walker has been very instrumental in the communication with you all, and we do appreciate her support in this process as well as yours. Having to say no more, I believe we will be sending you the certificates regardless if you claim for CEUs or not early next week. We will have the recorded webinar also posted in our website next week. So it looks like we're going to be very busy next week. But again, thank you all for participating. We will be in touch and hope to hear from you very soon. Thank you. Have a good day.